We're seeing how the new wave of generative AI-powered ambient AI scribes have the potential to change certain aspects of medicine and patient care for the better, with some very important guardrails and caveats put in there.
How can a set of skills lead you down the path to success? That's what we're setting out to answer on the EdUp Canada podcast. I'm your host, Michael Sangster. Join me as we unpack how leaders around the world have taken training and skills and turned that into a lasting career. Now let's learn together. Welcome back to the EdUp Canada podcast, where we explore the individuals, programs, and stories shaping Canada's vital industries. As part of our Skilled, Trained, and Trusted Healthcare campaign, we aim to recognize healthcare as a skilled trade and collaborate with leading voices to address the labor and skills gap in this critical sector. Today, we are privileged to have Dr. Rashaad Bhyat, Senior Clinical Leader at Canada Health Infoway, to discuss innovation and digital health solutions within the Canadian health landscape. Canada Health Infoway, a federally funded not-for-profit, is committed to advancing the development, adoption, and effective use of digital health solutions across the nation. I'm especially interested to do this interview today because I spent part of my career working in this sector and have a good knowledge of it, but I also am aware of what our colleges are doing to train students to come in and be ready to assist doctors and nurses and assist in these kind of roles. So Dr. Rashaad, thank you for joining us. Can you take a moment and maybe introduce yourself to our guests?
Sure, Michael. Thank you so much for the opportunity to join you and the audience of the EdUp podcast. So I'm a family physician with special expertise in digital health or health informatics. And as you said, senior clinical leader in the Center for Clinical Innovation in Digital Health at Infoway, Canada Health Infoway. I practice family medicine in Brampton, Ontario, where I'm also supporting the new TMU School of Medicine from the perspective of digital health as their digital health lead. And over the past decade or so, I've had the privilege of providing expertise to Infoway and our partners on connected care, interoperability, electronic medical records, virtual care, artificial intelligence, and pretty much everything in between.
So you're still currently practicing as well? I think I heard you say that.
Yes, indeed. Yeah, I've been practicing in Brampton for most of my career. It's just northwest of Toronto in Ontario. And yeah, it's a great privilege to be practicing family medicine. It really grounds me in all of what I do, but especially work in the digital health arena or in that profession as well.
So Canada Health Infoway, the new medical institute in Toronto, practicing. You got a lot of things on the go.
Yeah, I mean, I suppose I'm like a number of other professionals and family doctors in particular. We kind of have an interest in everything, which is partly why we went into family medicine as opposed to a very a specialized area of medicine that focuses on one thing only. And in family medicine, you see a bit of everything right across all the specialties, and it's obviously a specialty unto itself. And like many family docs, I wear many hats, I guess if you call them.
So I look at that as training, policy work, and practicing. So that leads me into my first kind of question here. How do you envision the future of healthcare in Canada? Do you see what changes and advancements? Because that's a unique perspective you've got.
Well, we're in a challenging time in healthcare in Canada, but not just in Canada, right around the world. And despite all the challenges with the healthcare system that we're facing, I do have a glass half full view on the future of healthcare in Canada. I believe it will be a positive one for patients and providers. First, I see patients being able to engage with the healthcare system in a more robust, more modern digital way in many ways, much like what we expect from engaging with other aspects of our lives as Canadians, like the banking system or arranging travel. Patients will have much more access to their records And I believe legislation will be evolving over time to support that access and ownership. My hope is that clinicians will also have far more useful digital tools available to them right out of the box from the get-go in a very seamless, integrated manner. And that policy and practice models will also evolve to support doctors, nurses, pharmacists to be able to participate in a digitally connected environment without downloading administrative burden onto clinicians, which is currently, unfortunately, one of the challenges that's also happening in the healthcare system. So it is a glass half full view of the future. I think it will be a place where we, as Canadians, we will be able to navigate the system in a smoother way once a few more pieces of the puzzle come together. And it may take a good bit of time for that to happen, but I do see it happening.
Let's go to Canada Health Infoway. The work that you do there focuses on integrating digital healthcare solutions. And I mentioned earlier, I've got some experience. I used to be involved in a company called Assure Health, you might know, and then TELUS Health when I was an executive at TELUS. So I spent a lot of time around digital health records, electronic medical records, and that kind of field. So I know the importance of it and the importance now of training people to have the skills to be able to do that work alongside the doctors. So why would you say the focus on digital health records is such a crucial in improving our healthcare system?
I mean, it's extremely important, and I can maybe set a bit of context around how we got to where we are in Canada at the moment. And again, reflecting that Canada is a very diverse nation made up of many regions and peoples, including Indigenous peoples, and that digital health, as it has evolved, it used to be called e-health or health IT, has been a journey, and it has not been a perfect journey. It's been a bit of a bumpy path, and we're in a state of ongoing digital transformation. That has been, in the time that I've been in the profession, it's been ongoing. There have been some really interesting stats that you can pull out that show that there has been change, despite the fact that it has been not the easiest path. So, for example, 95% of physicians, based on a CMA Infoway survey last year in 2024, are 95% of physicians are using EMRs. And if you compare that to, say, 20 years ago, it was under 30%. So we've come a long way. In the middle of that, we've had a global pandemic caused pain and suffering for Canadians and people around the world, lots of duress. Physicians, patients, other healthcare providers saw an advantage during the pandemic of being able to provide care remotely and digitally. But despite the fact that virtual care tools in that time became a little more normalized, the stickiness of that adoption didn't really hold for a bunch of different reasons. But the digital transformation continues. And what I'm getting to is the fact that, we have all these systems that have evolved and that have been digitized in healthcare. And, if I look at my own profession, medicine in particular, but they're not speaking to each other using the same language. And that's for all sorts of reasons, some of which are related to how Canada as a country is structured, legislatively, how our federation has broken down responsibilities between provinces and territories and the federal government relating to healthcare. But what I'm getting at right now is that this challenge is the frontier that Infoway has been tasked with tackling, which is connectedness of care, which in the technical space is called digital health interoperability. And it's extremely important because, a lack of connectedness between systems not communicating with each other, between doctors and nurses, doctors and doctors, between doctors and patients, it adds to enormous risks for patient safety and reduces the quality of care. It causes a fragmentation of data in silos all over the place in a particular province or region. And it also has contributed to an enormous administrative burden that physicians in particular, but other healthcare providers are experiencing, in part due to poor tools, systems that still rely heavily on fax technologies and phone and just aren't speaking the same digital standardized language. So that's one of the reasons that Infoway has been working on interoperability in our latest iteration, because we have been changing over the years. And Health Canada is obviously our funder and have asked us to double down on focusing on enhancing interoperability. And we're working with partners like CIHI, very closely with CIHI, with StatsCan, provinces and territories. And we have a roadmap for this. So we've developed this roadmap in consultation with all these partners to advance interoperability. It's work that doesn't happen overnight. It takes a lot of time, but some of the key features of that are reducing the blocking of data and siloing of data, and trying to ease portability using standards. So trying to rally everyone around using certain standards for certain types of tools. So for example, electronic prescribing. Infoway's been working on Prescribe It over the past number of years, which is the national electronic prescribing service that uses one standard and has actually made incredible progress in terms of connecting many disparate systems on the pharmacy side, on the physician side, electronically using the same standard. There are also now emerging standards that we've been working on relating to electronic referral, electronic consult, and something called the patient summary, which is intended to use an international standard in the Canadian tailored for Canada that each of the provinces and territories can align with and modify, so that it fits some of the provincial and territorial and Indigenous variations. But all of these pieces are part of that broader interoperability or connected care roadmap.
95% of doctors are now using some sort of electronic. That surprises me that the numbers have gotten to that level.
Yeah, I mean, they had been cresting 90% as of 2022. That was in primary care. Primary care had been so primary care is mostly family medicine. So they had been already cresting 90%. And again, part of that is some of the work that the provinces and the territories plus Infoway had done between 2010 and 2017, 2018. There was a lot of funding put into trying to have physicians in particular adopt electronic medical records, and then to not just adopt them, not just get the boxes on desks and the software, but actually use it in an optimized way, we would call it, rather than just having a digital filing cabinet. You try to actually figure out what these tools could do. This was going back 7 to 10 years, what they could do versus what you were not able to do with paper, right? Now, we're in a completely different era in 2024 with the advent of artificial intelligence, particularly generative AI, over the past, in terms of the incredible steps that AI has taken over the past few years. And I can touch upon that later, but we have made some big strides in terms of the actual digitization of care. The challenge is connecting care, and also how well those digital tools are suited to practice. And that's, what I was referring to in terms of the administrative burden. A lot of that administrative burden and clinical burnout that doctors and nurses are experiencing, doctors in particular, has been linked directly to electronic systems. So there's been a digitization, but not a true digital transformation, meaning that, young doctors and, nurses, when they're coming out of medical school and they're coming out of nursing school and they head into a practice, they might be expecting things to work the way they interact with the world through, say, an iPhone or your Google device, your Android device. And that is unfortunately not the case. It's actually quite jarring for folks to walk into an environment that is as disconnected and still reliant on fax and paper in between these systems that have been implemented. So lots of challenges, but again, I do see the landscape improving over time. And I would say that most doctors, if you ask them, would not want to roll back to the time where you were using purely paper records. There are lots of things that you just cannot do with paper that you can do now in a digital environment. We are in an information age, and medicine is increasingly an information science in addition to being medicine.
Let's roll back to training, because one of the great things that I'm seeing is a number of our colleges are now training in the career college sector. As I mentioned earlier, digital office records, medical office records, administrative roles. And we're seeing much more acceptance. We've seen some creative programs across Canada too, in the way they train and the way they get them to work in hospitals right away to take that pressure off. We did the same thing in our sector with training PSWs or healthcare aides during COVID, where they were in high demand to get into long-term care into hospitals to help alleviate some of that pressure on doctors and nurses that were overrun and just needed help. So, from your perspective, are you seeing anything on the training side, specialized training, technical training, and where we should be thinking about those kind of issues in the college sector?
Yeah, it's a big question. It's a huge question in the sense that it covers, the broad expanse of clinical professions, right? And I can really only speak more to the medical side. That's the area I'm most familiar with. And I would put it this way: healthcare professional training and education has evolved out of necessity to keep up with new realities, right? So 25 years ago, graduates of nursing and medical schools, pharmacy schools wouldn't have been walking into a highly digitized environment at that time. But now this is the case. So digital health has become health. Students have to be prepared for what they will encounter, which includes EMRs, EHRs, hospital information systems, all of these digital assets. And it's an ongoing challenge. Medicine in particular, in Canada, we had 17 medical schools. It's now expanding to more. Medicine has had, I would say, challenges with adding in specialized training, for lack of a better word, relating to digital health and health informatics for lots of different reasons. The medical curriculum is jam-packed into 4 years or 3 years, depending on the school. And there's not a ton of wiggle room. So a lot of thinking, and this has been an ongoing discussion, was how can you integrate these themes into medical education, into nursing education? And there has been a lot of work in different pockets. Some medical schools have made strides, and others are also on board with trying to move forward in terms of specific training related to certain technologies. But it's not just about the technology. And this is some of this, the thinking that I'm trying to weave in the work with TMU in Brampton in the new medical school there. It's really about training young clinicians or clinicians going through their education processes about the fundamentals of health informatics and clinical informatics, and understanding how information, how health data is managed, and how powerful it can be if you understand how it moves around, how it can support effective patient care, how it can support effective team-based care, which is what we're trying to encourage. And, it's also trying to train these clinicians coming through their undergraduate and then postgraduate training on how to be advocates in the digital landscape, from a digital perspective, how to be leaders and how to bridge that gap between the technical digital world and the nursing world or the medical world or the pharmacy world, because those are the folks who will be able to lead change, to be able to advocate for better co-design of systems so that the systems work better for clinicians with regard to their clinical workflow, so that they work better for patients and actually, have a direct impact on patient care. And this is also getting clinicians thinking about the patient lens, and how co-design with patients is also very important as time goes on. So that's sort of a long way of answering your question, but there are a lot of bright lights on the horizon in medicine, medical schools, in nursing schools, and other professional schools across the country.
The point, I guess the one thing I'd add to your commentary is that there's been a greater appreciation about the other people around the doctor, nurse, that need to be trained on have all these skills. And there's a much more acceptance, a higher level of acceptance of the need for us to bring in more medical office assistants, digital people who can have a concrete role on the day-to-day. And as I was pointing out, start there. I'll leave it at that, but that's kind of where I was at. We always ask a couple of personal questions, and I got one before I'll finish with the last one, but tell me a little bit about a skill that's made you successful. Obviously, you're good at multitasking, but with working on 3 different jobs right now, but tell me about a skill that you developed and whether you developed it early in life or later in life.
I think this is something that most students, most people could develop. And I'm fortunate to have been in a position over the years where I was able to build upon this skill, if you could call it that, for lack of other words, it's having an interest in everything and being interested and fascinated by all sorts of things. I mean, I've always been interested in all things technological from a very young age. That's not for everyone, but I think what I would say to people is have an openness and an interest within your profession, speaking to individuals from other professions, learning from other professions, and just being generally interested in everything. Because, when you get to a certain point in your career, you'll notice that there's an intersection of lots of different professions and domains. And sometimes you can really have interesting synergies that pull together ideas from different areas and different parts of your life, whether that's friends, family, colleagues, people that you interact with either directly on a day-to-day basis, or people that you may have come into contact, through jobs you've had, through volunteer work that you've had. So it's that interest in everything, and then trying to integrate that. I think there's a word for that now. I think it may be a bit of intersectionality. I think that's something that I've heard.
It's as simple as curiosity.
Curiosity nails it. That is absolutely it.
Sometimes we try and create fancy words for the ones that work. Paradigm shift is the one for a while there, with everybody was ending every conversation with this meeting was a paradigm shift. So Canada Health Infoway has made great strides for those of us who've been watching over the years in bringing people together. Are there any new initiatives or projects underway that you think are of interest to our listeners?
I guess what I might say is, for our listeners, keep an eye on the CIDH, the Center for Clinical Innovation and Digital Health within Infoway, especially if you happen to be a clinician or a clinician in training. We did have a Connected Care Clinical Innovation Grant this past year. That was one of our initiatives that I was really championing, trying to encourage and support innovation in the digital domain from the front lines of clinical care. There was also our clinician student scholarship program that we just launched and announced the winners of. And there's a really interesting program that I can only sort of hint at and comment on in broad strokes, but it's relating to a new and emerging technology, artificial intelligence based scribes, or ambient AI scribes. There's a lot of interest in these tools across healthcare at the moment. And in Canada in particular, we're seeing a lot of interest in primary care, but also in acute care. And we're seeing how the new wave of generative AI powered ambient AI scribes have the potential to change certain aspects of medicine and patient care for the better, with some very important guardrails and caveats put in there. So just to give you an example, artificial intelligence, ambient AI scribes, what they do is, when you're having a conversation, let's say a doctor or a nurse is having a conversation with a patient, they listen to the conversation and they don't just transcribe the conversation, they transcribe it, but they're also able to synthesize it and format it in a way that essentially creates the physician or nurse's note. In this case, I'll say physician's note, in a format that is good to go, with review, of course, for accuracy, but could then be inputted into the patient's chart. So it reduces a chunk of time burden, administrative burden, you could call it, that some doctors have, but it's not the be all and the end all. And it's actually sort of, I would put it this way, a means to a bigger end, which would be to lay the foundations for better data quality in electronic medical records and electronic health records, better data quality, better standardization of data, leading towards a greater and safer interoperability of standardized data between systems. So that's an interesting area that Infoway is exploring at the moment with provincial, territorial, and other partners across the country.
There's one area that I'm not concerned about AI. It's actually in healthcare. And I've just recently read a study about, it was an eye care. They were doing eye exams. And I can't remember the right word for it today, but they were using AI to study the exam results. And they were moving 100 times faster. I don't know what the number was, but they were actually found out by the end, they were getting better results on the eye exams and finding what the problems were. The doctors were still reviewing everything, but it queued them all out, and it was incredible how much faster they were able to do the work. So there is some room there for AI to be very, very helpful in healthcare. So we try and keep this to 30 minutes. We're coming up to there, so we always like to finish strong. Tell me about somebody in your life, because we've got a lot of listeners that are students in our college sector. Tell me about somebody in your life that was a mentor to you, that made a difference in your life, because I always say you've got a chance. We all have a chance every day to mentor somebody. Sometimes you know you're doing it. Sometimes you don't know you're doing it. But tell me about one that affected your life. And then tell me whether or not that person you think knows that you think of them as a mentor.
Okay, so there are actually a couple of people who come to mind. One is an ER physician who I had the great fortune to shadow when I was thinking about medical school and then in medical school, and that was Dr. Tom Stavro in the East End of Toronto. And unfortunately, very sadly, he passed away. But he was just a very genuine, caring individual who took the time to really sort of open up about what medicine was really like and what to expect. I don't come from a medical family, and so he was a friend of a friend at the time, and this is going many years back. So I was really fortunate that he took the time out of his incredibly busy days, just a very genuine, kind, and caring and humanistic person and physician. So that's one individual. And the other is my Uncle Jim, who's a really impressive individual and has accomplished a lot in his life and always had some really clear and sometimes very succinct advice on life arcs. And sometimes, when you're a young person, your parents might tell you things like this, but you're not always listening to your parents, right? And so sometimes if you have someone else who gives you these kinds of tips, it really helps. And a lot of what I learned from him was grit as well, which I also learned from my parents and my family. So.
Well, that's great. We appreciate that. It's always interesting to hear the different paths people have gone on and the ways people have interacted with them on those paths to help them out. Before we call it a day, is there anything you wanted to add? Any messages about Health Infoway that you think people should know about?
I mean, really, I would say to the audience listening that, again, we've had a very tough time in Canada as Canadians in healthcare over the past few years, especially coming out of the pandemic. But, we are going through a gradual digital transformation that I think really holds great promise for better, more modern, more patient-centered care. And I would recommend that if people have a minute, they check out our website, and in particular, our Digital Health Interoperability Task Force report and recommendation, which came out in November 2024 and is really intended to lend a clinical voice and some thought leadership to continuing the momentum on digital health interoperability and connecting care and advancing the connectedness of care over the next 3 to 5 years in Canada.
I was just going to mention that report because I went through it the other day, and I think it's something it's important for anybody around the healthcare system and even Canadians in general to give it a read and see what the recommendations were for going forward. So with that, Dr. Rashaad, thank you for what can only be called insightful discussion. Your expertise and the work of Canada Health Infoway are crucial in sustaining Canada's leadership in healthcare technology. We also commend the Connected Care Scholarship for its vital role in nurturing the next generation of healthcare professionals. We're looking forward to participating in the next wave of that program in a more in-depth manner. And with that, I think we'll call it a day for the EdUp Canada podcast this week. Hopefully you all get a chance to join us next Wednesday when we release the next episode. Thank you very much. Thanks for listening to another episode of the EdUp Canada podcast. We release new episodes regularly, so make sure you hit that subscribe button so you know when they are officially out. If you love this episode, please leave a 4 or 5-star review wherever you listen to your podcasts so that others can also discover how a set of skills can lead to success. Thanks for learning with us.